Ready? Start. On July 24, 2023, the United Nations General Assembly adopted a resolution to declare October 29 each year as International Day of Care and Support. Stop. This resolution recognized the critical role of comprehensive care and support policies, aimed at reducing, redistributing, and valuing unpaid care and domestic work, to the well-being of society and all its members, in particular, children, older persons and persons with disabilities, more so, as a disproportionate share of care and domestic work is undertaken by women and adolescent girls. Stop. It also remains invisible, undervalued and unaccounted for in national statistics, and neglected in economic and social policy making. Stop. Para. India has had a long history of care provision with institutions outside the family emerging in the late 19th and early 20th centuries with the work of educationists such as Tarabai Modak and Gijubai Badheka. Stop. These pioneering efforts, with developmentally appropriate practices, gradually declined as modern child care provisioning emerged post-independence. Stop. With modern child care mostly in the private, voluntary sector, low-income families, those who needed child care services the most, were excluded. Stop. Para. The report of the study group on the development of the preschool child, submitted to the Government of India in 1972, with Meena Swaminathan as its convener, transformed the history of child care services in the country. Stop. It set out a clear social justice agenda, emphasizing a holistic approach to address the health, nutrition and developmental needs of the young child, especially from poor and marginalized communities. Stop. Para. This resulted in the launch of the Integrated Child Development Services Scheme ICDS in 1975. Stop. It is one of the world's largest early childhood development programs today, with 1.4 million Anganwadi childcare centers operating across the country, reaching 23 million children, and serviced by around 2.4 million Anganwadi workers and helpers. Stop. Based on estimated population projections, and the need to reach over 60 million children by 2030, this number is likely to almost double to 2.6 million centers with over 5 million workers. Stop. Para. As several national and global studies have revealed, despite recognizing the importance of care for societal growth and well-being, care workers have remained underpaid and undervalued, and their contributions to the early development of the child not fully recognized. Stop. The pressure on the ICDS to rapidly expand to ensure universal coverage has led to a lower emphasis on pre-service and in-service training to build competencies of the care workers in practice-based learning, that is crucial for quality childcare. Stop. This is partly driven by the perception of early years teachers as carers, addressing primary needs of food, hygiene and immunization, not as professionals stop. The devaluation of their roles, of not being treated as professionals workers, results not just in low pay but also a lack of attention to working conditions in bracket including paid leave bracket close, social security benefits, opportunities for career advancement, and collective organization and representation stop. In many states, their wages, in the range of rupees 8,000 to rupees 15,000 a month, are barely on a par with the minimum wages for unskilled workers. Stop para. In the context of climate change, the need for good quality childcare services for the rural and urban poor is rapidly rising. Stop. There is sufficient evidence to show that poor women and children are the worst affected by the impacts of climate change and extreme weather events. Stop, such as floods or droughts. Stop. They confront reduced access to health and care services, alongside diverse and healthy food. Stop. While the Sustainable Development Goals suggest the need for a more equal sharing of care responsibilities between women and men in households, climate change is forcing many men to migrate out of their rural homes to urban centers in search of work. Stop para. Apart from their own dire circumstances, as witnessed during the COVID-19 pandemic in India, their physical absence makes such sharing impossible. Stop. When families migrate to urban areas, the higher costs of living, in particular rentals, make it imperative for women to find work too, which is often domestic and care work in the homes of the middle classes. Stop. There is, however, little care provision for their own children, with only 10% of Anganwadi centers currently functioning in urban areas. Stop para. The Government of India's Time Use in India 2024 survey confirms the feminization of care work, with women spending an average of 426 minutes a day in bracket over 7 hours on unpaid domestic and care work as against 163 minutes in bracket over 2 hours by men in bracket Ministry of Statistics and Program Implementation bracket close. Stop. Together, this would constitute 15% to 17% of GDP. Stop. Smaller scale studies demonstrate clear links between the mother's lack of time for care and feeding and child undernutrition, as visible in the persistently high child stunting levels at over 35%. Stop. Only 11% of children aged 6 months 23 months had a minimum acceptable diet in bracket National Family Health Survey 5, 2019-21 bracket close, raising cognitive and developmental concerns. Stop.